Guinea is facing an unprecedented epidemic in the distribution of cases of Ebola, with new ones confirmed in several towns and in the capital Conakry. To date, Guinean health authorities have recorded 122 suspected cases and 78 deaths. Other cases, suspected or diagnosed, were found in Sierra Leone and Liberia. In recent years, MSF has intervened in almost all reported Ebola outbreaks, but the virulence of the strain and the distribution of cases in several regions are complicating the work of its teams.
On est confronté à une épidémie d'un type qu'on n'a jamais vu, une ampleur qu'on n'a jamais vue, par la répartition du nombre de cas sur le territoire. Il y a eu des cas à Nzérékoré, des cas à Macenta, des cas à Kissidougou, à Kéguédou, maintenant à Conakry. Ça nous complique énormément la tâche, les autres épidémies étant beaucoup plus concentrées que celles auxquelles on est confronté actuellement.
MSF has set up 2 structures for providing care for patients in Guékédou, Macenta, in the Guinea Forestière region, and is strengthening the support for the ward in the Donka Hospital of Conakry. Every person looking after infected patients must follow strict protection rules, wear a waterproof suit, gloves, a mask and protective goggles, and be vigilant when administering treatment. Decontamination chambers have been installed between isolated patients and the external environment.
On est confronté à la souche la plus agressive d'Ebola, la souche Zaïre. C'est une souche qui tue plus de 9 personnes sur 10. Il n'y a pas de traitement, donc on n'a pas un médicament qui tue spécifiquement le virus. Notre action vise à les rendre plus forts, à faire en sorte que leur corps ne soit pas déshydraté, afin qu'ils arrivent à produire des anticorps qui nettoieront alors le virus de leur corps.
MSF teams have no alternative but to address the symptoms and try to reduce Ebola's very high mortality rate. They are administering drips to patients who have become dehydrated by diarrhea and checking if they don't have a different disease, such as malaria or a bacterial infection. If a patient loses consciousness or bleeds heavily, there is no hope. At this point, we provide palliative care by easing the pain and allowing patients to die with dignity.
On est les seules personnes en contact avec eux physiquement, donc on essaie de les toucher beaucoup aussi pour qu'ils aient un contact physique, parce que là ils sont vraiment seuls, personne ne les touche, c'est difficile.
The priority for MSF teams on site is to identify suspected cases and isolate them. This is the only way to break the virus's chain of transmission. Therefore, one activity involves monitoring anyone who has been in contact with suspected or confirmed cases. Affected communities must be informed about the illness and the precautions to be taken to limit the risk of contamination. MSF continues to strengthen its teams. By the end of the week, around 60 field workers with experience in responding to outbreaks of hemorrhagic fever will be divided between Conakry and the southeast of the country. In addition, 40 tons of equipment have already been flown into the country to try to curb the spread of the disease as quickly as possible.